Pakistan is historically endemic for malaria. So nowadays, malaria is almost confined to these three provinces: Khyber Pakhtunkhwa with tribal belt, Balochistan bordering with Iran and Afghanistan, and the Sindh province, mainly the rural Sindh. We have both the species of Falciparum and Vivax, with Falciparum being considered the most dangerous species in the past. With the interventions focused on Falciparum, we did bring the incidence of Falciparum down to an acceptable level, but unfortunately, we didn't actually target the Vivax species, which constitutes the major proportion of the malaria burden in Pakistan, more than 80%, and that is a major challenge.
For the last 4 years, since 2021, MMV have been hosting the Asia-Pacific Malaria Elimination Network Vivax Working Group. When we were first working on the Vivax Working Group plan, we realized that Pakistan was one of the highest burden countries in the region for Vivax malaria. And so we began to engage with the Directorate of Malaria Control, Dr. Mukhtar, to discuss what they were doing for Vivax. At the time, Vivax constituted 95% of their caseload. They were, in theory, using primaquine 14-day, but they said to us there's an issue with adherence, patient compliance with taking the full course, and health workers often weren't very keen to prescribe primaquine because they were worried about G6PD. So with tafenoquine being registered for the adults in Pakistan, the next plan is to learn from a G6PD pilot that we supported recently in 9 health facilities, and to then move forward to see if we can expand G6PD testing and identify where the program might want to consider putting tafenoquine in the early stages of implementation.
I have started hearing about APMEN working group through certain surveys, and then we have started talking with Kerry and Minaj regarding the G6PD training for the malaria control program, as they are planning to introduce the tafenoquine in Pakistan. So as we have been using it in our clinical trials in Sindh, so we have a pretty good experience on use of these G6PDs. So we have been approached by MMV to facilitate the training for the participants for National Malaria Control Program people, and that is how we started working with APMEN Vivax Group.
As a part of National Vivax Elimination Roadmap, country launched a very comprehensive G6PD pilot project in 9 selected districts of the country to evaluate the feasibility of the G6 pilot project in our routine healthcare system. National program has a very comprehensive plan for the elimination of the Vivax. We developed our national roadmap for the elimination of Vivax in 2022 through the technical support of the APMEN Vivax Working Group. According to that plan, we are going to launch the tafenoquine tablets, which is the single dose, instead of the 7 days primaquine, which will enhance the compliance by the patient as well as the healthcare providers.
The paroko cheda malaria rana dwema woko cheda the strogolo la para cheda kadaga test tagai tikistan bong batata da golai da kolmati which is the ke da jigar da para sta da khawshe dat la de munga da golai dar kuch sta jigar na da malaria khatmish
كده تقريبا 120 cases من سر per day راځي دغه تقریبا 80 اور 90 پوري cases من سر پوزټیو او هغه پی وی تقریبا موږ ته اول د تکلیفاتو چې موږ سره اول د جی 6 پی ډی چې و دا تقریبا لیټ موږ ته ملاو شو نو موږ نه پروسیجر چې هغه تقریبا څلګونی موږ نه لښیو ارشو نو هغه لیټ بیرالو او بل دا چې موږ دلته برډن ډیر زیات دی من کسان کم یو نو دا غیم دغه به یو کس جی 6 پی ډی د پاره نو نور مرګرو بیا هغه برډن راته هغه دغه طریقه چې کوم جی 6 پی ډی کوم طریقه هغه پروسیجر چې کوم هغه د منګه دغه کړم
जो टेस्टिंग है G6PD की वो रेगुलर बेसिस पे होनी चाहिए और उसको बाकायदा हर जगह हर हॉस्पिटल में प्रॉपरली G6PD टेस्टिंग जो है वो रेगुलर होनी चाहिए। उससे कॉन्फिडेंस बढ़ेगी, पेशेंट में भी बढ़ेगी, और जो डॉक्टर्स हैं, मेजॉरिटी ऑफ डॉक्टर्स जो है वो हेमोलाइसिस की वजह से, डर की वजह से प्रेमाक्विन की यूजेज जो है वो उसको प्रिस्क्राइब करने से वो बड़े रिलेक्टेंट होते हैं। तो मैं समझता हूँ कि अगर ये चीज़ हम एक रूटीन बना लें, इसके साथ जो अटैच चैलेंजेस है उसको तो ओवरकम किया जा सकता है। हमारी अपनी एफर्ट्स, अपनी एक्सपर्टीज़ उस पर हम कर सकते हैं।
Yeah, based on the results of the pilot project, we are going to scale up this project in the country as a part of our national Vivax elimination roadmap. For this purpose, there is a very breakthrough in our country that the tafenoquine, which is mainly going to use as for this elimination of Vivax, has been registered in Pakistan. It's a very big achievement of the program that we are going to have the tafenoquine, which is actually the real weapon for the elimination of the Vivax in the country.